All right, folks, how many of you know about home remedies when it comes to you being sick? And boy, I've heard some crazy stuff, but some folks swear it works. Now, you know it's helpful advice, but some stuff is also harmful. So here to separate fact from fiction is Dr. Jennifer Caudle. She is family medicine physician and assistant professor of osteopathic medicine at Rowan University. Doc, how you doing?
Hey, Roland, how you doing?
Doing great. All right, so let's get right to it. We talk about some of these medical myths. All right, what's the first one that really jumps out at you?
Well, you know, I'm a family doctor. I'm a family physician, so I see patients pretty much every day in the office. And one of the things that people don't think they need to do as they get older is come to the doctor, period. I think one of the biggest things is I often see patients who say, well, doc, I've been fine. I've been healthy. I don't ever get sick. So I haven't been to the doctor, they say. And I think one of the biggest problems is that you still got to come every year for a checkup. And there's lots of things that we need to be doing. But not thinking that you need a checkup, in my opinion, is a problem.
So, Doc, let's talk about that, because you talk about not going to the doctor. It amazes me when people play that game and then all of a sudden it's like, oh my goodness, it was too late. What was I thinking? But it's also a matter of that, well, if I go to the doctor and they give me something, I'm going to end up being sick.
So you're talking about like immunizations? Or
right, absolutely. I mean, because people say, oh, no, I don't want to go to the doctor because if they give me some medicine, they give me a shot, it's just going to make me sick, even more sick.
Okay, so let's talk about vaccines. Now, last time I was on your show, we talked, I think it was maybe about the flu shot.
Right, right.
You know, I'm an advocate as a family physician. As a physician, I'm an advocate for preventive medications, prevention in general. And one of the best things we have is immunizations, but a lot of folks think that shots are only for kids. Shots are not just for kids. In fact, there are a number of vaccines that we should be getting as we get older. So let me give you some examples. So there's the pneumonia vaccine. This is not the flu vaccine, it's the pneumonia vaccine that usually people get around the age of 65, give or take. There's also the tetanus vaccine that we should be getting every 10 years. There's also a shingles vaccine on the market for people 50 years old and over. So the point being is understand that, you know, there's a lot of things we should be doing. Vaccines are one, and vaccines are not just for kids.
All right, Ray?
Dr. Caudle, we hear a lot of conversation about Eastern medicine versus Western medicine and the superiority and things of the sort. Where do you fall on the lines of whether there's a more effective form of treating health and disparities, or whether or not that, you know, it's just one's preference?
I mean, so you sort of using the natural methods?
The Eastern medicine often called natural methods.
All right, Doc?
So that's a really great question, because I think a lot of people today are looking for natural ways to help the body. I think that's a very natural and a very common thing that's happening. And I'm a fan of people looking for ways to help their body. I think we have to be discriminating, though. And by this, what I mean is, let me talk about supplements in particular, because there's a large category of things that could be considered complementary and alternative. And I'm a fan of many of them. But I want to talk about supplements because this is something I see a lot in my office, where a patient will come in, they've seen something on TV, maybe they bought some pills or supplements that said they were going to do X, Y, and Z, and they come in and maybe there are problems with that. You know, with supplements, we have to remember that supplement manufacturers and distributors are not required to get FDA approval before marketing their product. Right. One thing I often see, or have seen, I should say, is that sometimes supplements can interfere with other prescription medications. Sometimes supplements can cause problems in and of themselves. I actually had a patient that had went into renal failure as a result of supplements he was taking. That's not common, but it can happen. So what my stance is on that is, look, if you see something that you're interested in, talk to your doctor about it. Take that supplement in and talk with your doctor to make sure that's a reasonable thing for you to take. Because just because it says natural or all natural doesn't mean it's all good.
Doc, gotta ask you this here. Pull the graphic up, please. So, mammograms hurt?
Yeah.
That's also one of the top 5 health myths? Go ahead.
Yeah, a lot of women come in. I have a lot of women that are kind of reluctant about getting a mammogram, you know. People are sometimes reluctant about a lot of things, getting colonoscopies, getting other screens. But I've heard women say, oh, I heard that my girlfriend said it really hurt her, so I don't know that I want to get that done, they say. And look, the thing about mammograms is it may not be the most comfortable procedure, but mammograms do save lives. And I really think it's important. We got to look at the benefits of getting screened. And just because your girlfriend says it hurts, or it's not this, or it is that, you know, go back to your doctor and talk with him about it. But don't let that be a reason why you don't get a mammogram or don't get screened.
Doc, when you talk about talking with your doctor or even being proactive in your own health care, what are the questions we should be asking during our checkups? And what are the things by age that we should be looking for?
Okay, that's a great question. First of all, I say let's start from the beginning here, which is finding a doctor and how to find that right doctor. I really think that the doctor-patient relationship is one of the most important relationships we will ever have. Your doctor as a physician, I should know almost everything about you, and we don't usually tell that to a lot of folks. So first thing that will help make these conversations easier is to find a doctor that you like, a doctor that you trust, and one that hears you, that listens to what you're saying, that answers your questions and really hears you. Because when you have that relationship established, it will become so much easier to be able to ask those questions. But to answer your question specifically, all right, so you're going into the doctor. You need to find out, do I need blood work, doc? Do I need immunizations or vaccines? What are things I should be doing for my age? And as physicians, we have checklists. We have certain things that by age 40, 50, 35, we should be doing. So staying on top of that and going to your doctor is super important.
Kevin?
And doctor, this is a very personal subject for me, and I'm about to reveal a secret.
And I got about 30 seconds. Go.
I am a kidney dialysis patient. I had been on dialysis for 5 years. I was told that, oh, as you get older, your blood pressure goes up, all this other thing. But unlike most dialysis patients, I do mine at home. And I tell people that all the time, that when you have a predisposition genetically like I do for kidney disease, then you need to get seen by your doctor.
Thank you for that.
Doc?
You are so right. You are so right. And thank you for sharing your story. And I think you're going to inspire a lot of people to go out there and get checked and to take care of themselves and to do the right thing. So thank you for sharing that. But you're right. Go see your doctor.
Go get your butt checked. Let's put it that way. Let's put it out there where the goats can get it. Go get your butt checked.
Doc, how can folks reach you? They got more questions.
Oh, find me at Twitter at Dr. Jen Caudle or on my website at www.jennifercaudle.com.
All right, Doc, I appreciate it. Thanks so much.
Good to see you.
Folks, coming up.